brought you a lot of stories about how technology is changing the face of medicine, from remote training programs to portable ultrasound devices. But the story we're about to show you is next level. An actual robot surgeon. Tsulu has this story.
It's safe to say that robots are probably going to take over the world in the not-so-distant future. I mean, already they're vacuuming our houses, and a self-driving robot has already been cleared to deliver groceries. But who'd have thought that one day they'd be trusted to operate on us? Yes, you heard right. Robotic surgery was first introduced in South Africa about 2 years ago and is proving to be a successful alternative that offers patients remarkable benefits. Some of these include less pain and bleeding, as well as quicker recovery time. The Da Vinci has been used to perform various surgeries since it's landed on our shores. The machine costs around 22 million rand, and there are about 4,000 of them in operation worldwide, 4 of which are right here in South Africa. But how exactly does the system work?
What it consists of is a docking station where you actually have the ports in the camera, and you have a console where the doctor sits. The surgery is performed away from the patient, and what the Da Vinci system does, it allows for better outcomes in terms of wound healing, in terms of the surgery. It allows you to get into really small spaces, and it translates into a patient stay which is usually shorter, without compromising on the end result.
There's no doubt that we've seen a technological revolution in the medical field thanks to the Da Vinci. But recently, another medical milestone was reached when robotics was used to perform the country's first ever partial nephrectomy. Let's go find out what that means.
When you remove a kidney, it is called a nephrectomy. So we remove kidneys for different reasons. You have a simple nephrectomy where you're taking out the kidney for a non-cancerous cause. You have a radical nephrectomy where you remove the whole kidney because of a cancer. And in some cases, where your cancer is confined to a part of the kidney, we do something called a partial nephrectomy where we spare the good part of the kidney and simply remove the cancerous part.
The urology hospital in Pretoria has performed nearly 400 procedures using the Da Vinci, while 600 urology-related robotic surgeries have been performed countrywide. The machine is also proving to be the best solution in treating some forms of cancer. When I first saw doctors using the Da Vinci, it reminded me of a sci-fi movie, but also looked like they were operating a gaming console, which got me thinking, what kind of training is needed to become a robotic surgeon?
What it consists of is a training pathway. The first step is to actually become proficient on the robot, the workings, the side effects, troubleshooting, the different components. And you've got to pass a test. Your next step is to work on the actual console itself. And what you have to do is go through a series of tasks on the simulator. So you actually use the robot, but you simulate the different tasks. You've got to get above 90% for that component. Your next step in the training pathway is something called a wet lab, where you actually get to handle tissues, and these are usually animal tissues. The next step, obviously, is the live surgery, and this is usually performed by the surgeon, and in South Africa, obviously, it's performed with a proctor initially as you do your first few cases. And once you've done a certain number of cases, you are then certified to do the procedure on your own.
Robot surgery is more expensive than conventional operating, but with more companies like Samsung planning to manufacture these machines, the cost could drop. However, you should be covered for robot surgery if you're on any of the larger medical aid schemes.